Welcome to Lesson 10. In this lesson, we will study ICD-10-CM Chapter 6, which covers diseases of the nervous system, coded from G00 to G99. Lesson objectives. By the end of this lesson, you will clearly understand how to code dominant and non-dominant side. Pain coding using Category G89. When pain codes can be principal diagnosis. Pain control versus treatment of underlying condition. Post-operative pain rules. Chronic pain versus pain syndromes. Neoplasm-related pain coding. Important exam reminder. Always remember, pain coding depends on why the patient came for the encounter. Ask yourself, is the visit for pain control, or is it for treating the underlying condition? This decision controls sequencing and code selection. Dominant and non-dominant side overview. Certain nervous system conditions require identification of whether the dominant or non-dominant side is affected. This applies to G81 hemiplegia and hemiparesis, G83.1 monoplegia of lower limb, G83.2 monoplegia of upper limb, G83.3 monoplegia, unspecified. Why dominance matters. The dominant side is the side a patient primarily uses for daily activities. Coding the correct side reflects functional loss, affects reimbursement, is commonly tested in exams. Always check provider documentation first. Why dominance matters. The dominant side is the side a patient primarily uses for daily activities. Coding the correct side reflects functional loss, affects reimbursement, is commonly tested in exams. Always check provider documentation first. Default rules when dominance is not documented. If the affected side is documented but dominance is not specified, follow these official ICD-10-CM defaults. If the patient is ambidextrous, right pointing arrow default is dominant. If the left side is affected, right pointing arrow default is non-dominant. If the right side is affected, right pointing arrow default is dominant. These rules are exam favorites. Category G89 overview. Category G89 is used for pain not elsewhere classified. It provides information about acute pain, chronic pain, neoplasm-related pain, postoperative pain. G89 codes may be used alone or with other codes, depending on the situation. When not to use G89 codes. Do not assign G89 codes when pain type is not specified. The underlying diagnosis is known. The encounter is for treating the underlying condition. Pain is routine and expected after surgery. This is a very common CPC exam trap. Underlying condition rule. If a definitive diagnosis is known, such as spinal stenosis, vertebral fracture, and the encounter is to treat that condition, right arrow code the underlying condition only. Right arrow do not assign a G89 pain code. When G89 can be principal diagnosis. G89 codes may be used as principal or first listed diagnosis when the visit is for pain control or pain management. Example: a patient presents for a steroid injection to control severe back pain. In this case, pain code equals principal. Underlying cause equals additional diagnosis. Neurostimulator for pain control. If a neurostimulator is inserted only for pain control, right pointing arrow G89 is principal. If neurostimulator is inserted while treating the underlying condition equals principal. G89 equals secondary. Sequencing depends on reason for encounter. Combining G89 with site-specific pain codes. Category G89 codes can be used with site-specific pain codes when G89 adds extra information, such as acute or chronic. The site code alone is not sufficient. Example: acute neck pain. If the encounter is for pain management due to trauma, G89.11 acute pain due to trauma. M54.2 cervicalgia. Both codes are assigned because each provides different information. Sequencing rules. Very important. Sequencing depends on the reason for the visit. Pain control visit, right pointing arrow G89 code first. Any other reason, right pointing arrow site-specific pain code first. Always read the question carefully in exams. when no definitive diagnosis is established. If patient has pain, underlying diagnosis is not confirmed. Right arrow assign the site-specific pain code first. Right arrow then assign G89 if it adds information. Postoperative pain basics. Postoperative pain coding depends on provider documentation, whether pain is expected or abnormal, presence of a complication. Routine postoperative pain. Routine, expected pain immediately after surgery, prohibited should not be coded. This is considered a normal part of healing. Postoperative pain without complication. If postoperative pain is not associated with a complication, right arrow assign the appropriate postoperative pain code from G89. If not specified as acute or chronic, right arrow default as acute. Postoperative pain with complication. If postoperative pain is due to a specific complication, such as painful sutures, device-related pain, right arrow code the complication from Chapter 19. Right arrow add G89.18 or G89.28 if appropriate. Chronic pain, G89.2. There is no time limit defining chronic pain. Use G89.2 only when provider documents chronic pain. Never assume pain is chronic. Chronic pain versus pain syndromes. These are not the same. Chronic pain right pointing arrow G89.2. Central pain syndrome right pointing arrow G89.0. Chronic pain syndrome right pointing arrow G89.4. These codes require specific provider documentation. Neoplasm-related pain, G89.3, code G89.3 is used for pain due to cancer, due to primary or secondary malignancy, due to tumor. This code applies regardless of acute or chronic status. Sequencing G89.3. If visit is for pain control right pointing arrow G89.3 is principal. Cancer treatment right pointing arrow G89.3 is secondary. Underlying neoplasm must also be coded. Site-specific pain code needed? For neoplasm-related pain, prohibited a site-specific pain code is not required. G89.3 alone fully describes the pain. Common errors to avoid. Avoid these mistakes. Coding G89 when treating underlying condition. Coding routine postoperative pain. Ignoring dominance default rules. Using chronic pain syndrome without documentation. Incorrect sequencing of pain codes. Quick exam summary. Remember. Right side right pointing arrow dominant, default. Left side right pointing arrow non-dominant, default. Pain control visit right pointing arrow G89 first. Treating condition right pointing arrow no G89. Chronic pain does not equal pain syndrome. Cancer pain right pointing arrow G89.3. Student practice tip. Before coding pain, always ask, Keycap 1 why is the patient here? Keycap 2 is pain the main reason? Keycap 3 is there a confirmed diagnosis? Keycap 4 what type of pain is documented?